Okay, let's dive right into this. Welcome to today's Explainer, where we're tackling a universal reality that pretty much all of us have faced at some point: back pain. But, we're not just looking at the ache itself. We're going to trace it from that sudden, paralyzing moment it strikes, all the way to a completely unexpected and honestly highly dangerous hazard introduced by the very thing meant to cure it. Let's map out this journey together.
Section 1. The universal ache. The sudden onset.
So picture this. You bend over to tie your shoe, and bam, your lower back completely seizes up. In that split second, your mind starts racing, right? Which brings us to a really critical question. When does a simple ache actually become a medical emergency? You're hobbling over to the freezer for an ice pack, trying to figure out if this is just, typical muscle soreness, or actually, is it a dark structural red flag?
Moving right along to Section 2. When to seek help. Decoding the pain. To figure that out, we can't just rely on random internet forums. We need the experts, like the Mayo Clinic and NAMS. And this brilliantly illustrates the stark dividing line here. On one side, we have the wait-and-see category. This is your predictable, annoying stiffness that usually fades with a bit of rest. But on the exact opposite side, the see a doctor now column. These are the terrifying red flags indicating that something is profoundly wrong with your nervous system.
So, what do those red flags actually look like? Well, according to the data, your back pain is officially an emergency if you hit any of these three specific warning signs. Number 1, pain shooting down the leg, specifically below the knee. That is a classic sign of nerve compression. Number 2, numbness, tingling, or weakness in your legs or groin. And number 3, back pain accompanied by a fever. That one absolutely screams serious infection. If any of these happen, the wait-and-see game is officially over.
Which brings us to Section 3. The driving danger. The hidden hazard. And here is the massive plot twist. You've gotten your diagnosis, you've picked up your prescription, and honestly, you feel great. But official FDA guidance reveals that you may have just unknowingly walked into a huge pharmacological hazard: impaired driving. Now, culturally, we usually associate impaired driving with alcohol and, bad decisions at 2 a.m. But the FDA strictly points out that impaired driving is incredibly often caused by everyday, legal, properly prescribed orthopedic pain medications sitting right there on your kitchen counter. Now, what's really interesting about this slide is when we compare the medication types directly against their side effects, the danger becomes super obvious. I mean, muscle relaxants are fantastic for stopping back spasms, sure, but they significantly crash your overall alertness. Opioids treat severe acute pain, but they can cause profound drowsiness and severely impair your motor skills. So, ironically, you might feel perfectly fine to drive just because your back doesn't hurt, while in reality, your brain's reaction time is drastically reduced. It's a total illusion.
It all boils down to an incredibly direct, absolutely crucial warning from the FDA. Some medicines and driving don't mix. Simple as that. The medication is doing its exact job by dulling your nerves, which is great for the pain. But out on the highway at 60 miles an hour, you literally need those nerves to be as sharp as possible.
That leads us to our final part, Section 4, Safely Navigating Your Recovery, Managing Pain and Responsibilities. Let's move on and see how this builds, because obviously, life doesn't just stop because your back hurts. You still have to commute, you still have to function. So before you even think about getting behind the wheel with a new prescription, you need a foolproof protocol. Step 1, read the label. Seriously, actually look for those little warning stickers about operating heavy machinery. Step 2, observe your body's reaction. Take your first dose at home on the couch just to see exactly how it affects your alertness. And Step 3, consult your doctor. Ask them point blank if your specific prescription impairs motor skills.
So, I'll leave you with this. What hidden hazards are sitting in your medicine cabinet right now? Your back pain might be the absolute loudest problem you have today, but that unassuming little bottle of pills, it could actually be the most dangerous thing in your house if you use it right before a drive. Check your labels, truly understand the side effects, and please prioritize your total safety, both in your recovery and out there on the road.